Greetings guys, my name is Dr. Frimpong and this is MedNews, where we redefine medical education by sharing recent news on health. And today's health update is from the WHO and it is about tuberculosis. Now, world leaders at the United Nations General Assembly on tuberculosis have set new targets for the next 5 years as part of efforts to end the TB pandemic. And although they admitted that the targets were ambitious, they believe that all great journeys start with a single bold step. And so they aim to reach 90% of people with TB prevention and care services. And also, they aim that over the next 5 years, all nations should be using a WHO recommended rapid test as the first method of diagnosing tuberculosis. Providing social benefits packages to all patients with TB was also mentioned as a target. They aim to license at least one new TB vaccine. And then last but not the least is to close or bridge funding gaps for TB implementation and research by 2027. Dr. Tedros Adhanom Ghebreyesus is the WHO Director General. At the meeting, he was of the view that unlike our ancestors, we have been graced with more than adequate knowledge on tuberculosis, and so the targets set are a commitment to use that knowledge to write a final chapter on the TB pandemic. And so according to him, albeit ambitious, let's continue the journey, although it has already been started by past WHO chiefs. According to a report from the World Health Organization, global effort to combat TB has saved over 75 million lives since the year 2000. However, the targets which were set in 2018 were not realized, mainly due to the COVID-19 pandemic and ongoing regional conflicts. The targets in 2018 were also set over a 5-year period, and so this was not realized because of COVID-19 mainly and an ongoing regional conflicts. And so only 34 people of the intended 40 million people with TB were reached with treatment between the year 2018 and 2022. And as for the preventive measures, they were very affected, as only 15.5 million of the 30 million people targeted to be reached with preventive treatment had access to it, meaning a little less than half of people who were targeted to be reached with preventive treatment didn't have access to it in the year 2018 onwards till date. And so tuberculosis is an ancient communicable disease which primarily causes chronic inflammation in the lungs and is caused mainly by Mycobacterium tuberculosis. Today, TB remains one of the world's top infectious killers, and every year or annually, over 10 million people contract TB and over 1 million people die from it, although TB is a preventable and a curable disease. The WHO chief, Dr. Ghebreyesus, at the meeting officially launched the TB Vaccine Accelerator Council to facilitate the development, licensing, and use of new TB vaccines. Now, BCG is currently the only licensed TB vaccine, and while it provides moderate efficacy in preventing severe forms of TB in infants and young children, it does not protect adolescents and adults, who account for majority of TB transmission globally, and so there is a need to produce a vaccine for adults and then adolescents. Once again, this is Dr. Frimpong reporting from MedNews, and thank you for watching. Have a